anywhere, right? So in that time, you can just see the case notes. So basically, it's kind of blessing in disguise. You can thoroughly and you can say read the case notes, try to understand the story of the case, like why we are writing this letter, what is the reason of writing in that particular 5 minutes. Once it's, like if you do understand that why we are writing this letter, OET writing is just a piece of cake for you then. Okay. So anyhow, we will be having one profession specific task. Like there will be only one task in the writing of OET. It could be either referral, discharge, update, request, or so on. It's a kind of typical workplace related situation, like that the doctor do in his or her daily life. So basically, you can see there it's a referral letter, maybe it's a discharge, maybe scenario, maybe transfer or update or request. So these five, say, sort of scenarios, mostly we can have to write it down in the you can say OET medicine of your writing. We also have the education letter, right? We also have we can say information letter. We also have the we can say transfer letter. Anyhow, but like the most common type of letter will be referral, discharge, and transfer. These are the three major common type of letter. So let's say we have the marking criteria, such as your purpose of writing, your selection, your organization, conciseness and clarity, genre and style, and language part. So let's say what we have in the purpose of writing, because you need to understand this marking criteria on the basis of which your letter will be marked. So whenever you receive the case notes, you just go to the bottommost part of the writing task. So in the bottommost part, you have to see to whom we are writing this letter, who is the audience, and what is the issue. So issue could be maybe a referral case. We have a diabetes mellitus, we have AMI, we have inflammatory bowel disease, we have Cushing syndrome, and so on. Followed by the discharge scenario. Discharge is always a follow-up. In the medicine, we specialist is writing back to the GP. Transfer letter mostly is a kind of referral letter when we are changing the hierarchy from low to high, from side stream to mainstream. It could be a departmental staff transfer or same specialty transfer as well. So we have the thing that we can say can be categorized as a purpose of writing. So in simple word, to whom we are writing and what is the reason of writing. Once you understand the reason of writing, according to that particular reason of writing, you have to select the relevant case note. So relevant with reference to person or recipient to whom you are writing this letter, and relevant with reference to issue, if it's referral, discharge, and so on. So you should not miss anything that is significant. You should not omit or select anything that is irrelevant, and semi-relevant is your optional. Followed by the organization and layout. Now, in terms of organization or layout, it is very important for you to understand that there is no standard structure. Although we do tell you some format of writing for your basic understanding, but you have to be flexible with your structure. Anyhow, so organization of the information depends upon the importance of that particular history of the case notes. You have to sequence the information as per the appropriate requirement of the person to whom you're writing this letter or with reference to the issue. Do not follow a conventional sequence for all letter. Like we can see that the letter format may be different, the letter sequence may be different. As per the importance of the information, we can change the sequence of the letter. With depth, with practice, you would have an idea, because it could be a most frustrating point for you after writing few letters and getting the feedback. I'm telling you beforehand that it might be quite frustrating part for you. Sometimes you write down social history without understanding in the second paragraph. So assessor will correct you. No, you have to write it down with reference to that case notes in at the last part. No, you have taken the assessor words and you write it down the next letter, and without being knowing that if this social history is significant or not, you would write it down that social history in the bottom part of the letter, and assessor will correct you. No, you have to write it down in the second paragraph. You got confused. you will be frustrated. Now, what happening actually? Previously, I have written this history in the second paragraph, and I got a feedback that it should be written in the last visit. Now, in the next letter, I got this history in the last visit. I got a feedback to write it down, this thing in the second visit. So to answer this question, you should know that, like sequencing of any history, where to write it down depend upon the importance of that history. If that particular history is important to be written up above after the purpose or the introduction paragraph, we should write it down up above. But if that history is not important, we will write it down somewhere down the grade. Anyhow, followed by the conciseness and clarity. Conciseness and clarity mean that you should follow the guideline, such as we have to write it down 180 to 200 words. In that particular window, you have to compile your letter. But 180 to 200 words does not mean to miss something important. So you would be concise in your writing if you would have not written the irrelevant detail, number one. Number second thing is, if you have summarized the less relevant detail, right? And then if you have grouped the same or similar information together, right, you will be more concise and more clear in your letter of OET. Let's say, to give you an example, if you're writing a referral letter, we would see that if it's following a progression of events of the same disease, and now disease has established or the diagnosis has been confirmed, now you are, or maybe you have made an assessment, now you are writing to the specialist. So it would be written in a summary form for the first few visits, and then we can say today visit should be expanded. As you can see, this is a standard of referral letter that you have to see. But according to the case notes, I will give you a few example after some time, that how you can summarize the information, right? And discharge letter, again, in a conventional discharge, we have to summarize the ward detail and expand the discharge plan. Genre and style, in simple word, is your vocabulary. Genre and style, in simple word, is your vocabulary. Okay. So basically, in term of genre, you have to see that, like which language tone would be appropriate for a person to whom you're writing. Number one. Number second thing is, it should be a clinical or factual language. You should not use the contraction, like we use I am with I, comma, am. It's not allowed. Do not. Should write it down in full form. You have to use the clinical and factual language. Try your level best to change the case notes into your own language, but keeping the fact in mind that it should be a technical register that has to be followed. According to the recipient, let's say, mostly the symptoms, the patient would describe the symptom in his own language, such as shortness of breath. But now, you being a doctor, you're writing this letter to a specialist, you would translate this shortness of breath to the dyspnea, because shortness of breath was the language of the patient, and dyspnea is your language that you're telling to the consultant. Similarly, patient will write it down maybe in the case not tiredness, and you can write down lethargy, fatigue, and so on. So according to the recipient, you have to change the form. And even though, for example, if I don't, if even if I have written lethargy, I don't have any vocabulary word for that, so I can change this form to lethargic. But show some skills that you have an ability to translate the case notes into your own language. Do not write it down or use the same word that has been written in the case notes. Try to change it, but with caution that you should not change the meaning of the word, number one, and you should not translate in this way that it might not be appropriate word for the recipient to whom you are writing this letter. Anyhow, acronyms are not being appreciated, such as 2x52, like say for 2 weeks, for 2 months, and 3 days. Abbreviation can be used, but do not use them hourly, right? So this is about the genre, and the last criteria part is language part. Like say, as you can see that, their letter is normally reflecting the sequence of event that happen at different time. So according to that timing, you have to map your letter using the different format of sentence and tense structures. If you can see this thing from other perspective of the language component, let's say if you had qualified your letter with 350 score, which mean that your purpose of writing was clear, which mean that your selection was relevant, which mean that you had organized the letter as per the importance, and concise information has been projected in the letter. So these are the four basic criteria that can lead toward the pass-fail kind of thing. Even the minor mistake in purpose, minor mistake in selection, minor mistake in maybe organization can lead toward the failure. Somehow you would able to manage it, like the letter has been qualified 350 score, but to make it more appealing, to get it toward the 400, sorry, toward this journey, you have to add on the appropriate range of grammatical structure so that you can map your letter accordingly. Anyhow, and these are the six basic criteria of the writing task, right? Anyhow, so you can see, I will show you the next slide. Referral letter can be categorized into different category, and these are the categories I've done by myself. Might not be in the OET books. So I just have, try to make a list of referrals so that we can better understand, so that we might have some sketch in our mind regarding to different types of referral letter. So what I mean by a referral letter, a simple referral letter, when we have a diagnosis given in the case note, normally in a letter of referral, we always have a diagnosis given at the end of the letter. So let's say it's AMI, it's diabetes, it's Cushing, or if there is elevated blood pressure or so on. So we can write that simply the diagnosis in the introduction, such as these are some of the, we can say, conventional statement that you can use to write a referral letter. Thank you for seeing Mr. Mark, a 20-year-old accountant, let's say, whose signs, symptoms, and investigation are suggestive of diabetes mellitus for further management. It can also be written in different way. I'm writing to refer Mr. Mark, whose symptoms are suggestive of Cushing syndrome. If there is no sign, we might not, you can see, use the memorize statement. The common mistake I've seen, students memorize the statements. Even if there is no signs, they write it down whose sign and symptom are suggestive of. Anyhow, so this is a kind of example for you when we have the diagnosis given. Let's say if we don't have the diagnosis given, it's a kind of scenario without diagnosis. So now what we have in the without diagnosis, you just have, let's say, diagnosis given, symptom given, or investigation given. So we are not supposed to make the diagnosis from our own knowledge. We have to write it down, the symptoms only in the introduction. Just an example that has been done for you. Thank you for seeing Mr. Alex, who presented with 3-week history of lethargy, blood VN, and recent blood investigation showed high blood sugar values. I've not written diabetes because the GP has not made the assessment or diagnosis. So I would write it down, that thing as it is. This is just an example for without diagnosis. I'm writing the introduction for that so that you have an idea how to compile the introduction if we got the letter with symptoms or with investigation or with some science. Anyhow, afterward, we can see that we can also have a referral letter with differential diagnosis, right? It's very common. So differential diagnosis, let's say we have two primary issues, let's say A1 or A2. Then followed by, we have primary issue followed by two types, A1 or A2. Let's say these are two examples that has been done in front of you. Then we have the second type of DDs where we have two differential diagnoses, different diseases, AMI or APO. Then we have multiple diseases like BPAD, depression, schizophrenia, if we can see, and so on, 2, 3, 4, 5, 6, 7, 8. We can write it down in the DD. So letter of referral with differential diagnosis, these are some examples that has been done for you. Like I'm writing to refer Mr. Alex, whose signs symptom are suggestive of anally bowel obstruction, secondary to diverticulitis or carcinoma. Obstruction is there. We want to find the reason, either it's due to diverticulitis or carcinoma, right? This is an example for differential. Followed by the next letter, two different diseases whose features are suggestive of acute MI or acute APO for urgent management. Followed by the three differentials who have differential diagnosis of bipolar disorder, depression, or schizophrenia for a definitive diagnosis and further management. And if we just have we can say the symptoms, let's say, so we can just write it down. I'm writing to refer Mr. XYZ, who presented today with auditory hallucination, delusional thoughts, and he feels full up. I would appreciate if you could further investigate for a definitive diagnosis. So we can also write down the symptoms if you don't have the diagnosis given. And we can write it down, DDs, in the bottom of the letter. Anyhow, now we can see we have a type of discharge letter. Before we can proceed, if you have any question for referral letter, we can see there, we do not write down anything from social plus past medical history, right? Because it's kind of follow-up or specialist is writing back to the GP. That's why we are not supposed to write anything from the social history, family history, or past medical history, right? We do not write anything from the social history, past medical history, or family history. So what we are left with? We are left with, like few things such as ward stay or admission details, right? It can be written over here. And we have the rehabilitation or nursing management, right? Can be written over here. We have the discharge plan. So ideally speaking, what would be the structure? Because normally in a conventional letter of discharge, it will go in flow. What I mean by that, it will be in the progression of the disease. For example, if we have the letter, so ward stay and hospital stay, we should write in summary form. It should not be expanded because for a practicing GP, it's not something that is important, right? It is not something that is important. Followed by the, we can say, rehabilitation. Rehabilitation as compared to ward is not important, right? Rehabilitation as compared to ward is not important. Sorry, as compared to discharge is not that important. So we have to again summarize it down, but less from discharge, more from the ward stay, right? And it can be summarized with the ward stay. A discharge plan has to be expanded. So we have to write it down. I'm writing this letter of discharge regarding Mr. X, Y, Z, who has undergone, okay, who has undergone a successful writing replacement surgery and is being discharged today for follow-up, right? So this is the format of discharge letter. Now, a letter of request, we have to see that it would be written to the allied professionals other than from your mainstream letters. These are challenging in this way that normally in our setting in Pakistan and maybe India, maybe Sri Lanka, in such country like in subcontinent, yeah, in subcontinent, we don't have such particular setting, such as we are not supposed to write it down, the letter to the occupational therapist. We never had written letter maybe to a physiotherapist or to a social worker or to a pension care or maybe for home placement or for genetic review. So letter of request can be, you can have this letter of request in both format. Either it is in the referral format or it's in the discharge format. So basically, in any of the format, you can have this letter. It's kind of or more of inclined toward the referral format. Anyhow, so let's say if I'm writing this letter to the occupational therapist, if I can write it down in this way, I'm writing to request you regarding Mr. James' workplace assessment, as she has been recovering after a successful right knee replacement, and he want to resume a job, let's say. So basically, there was a patient. It's a kind of discharge request letter. There was a patient who had this successful surgery and he want to resume his job, but we just want the occupational therapist to go to his place and go for the hazard assessment. So it's a kind of occupational letter that you can see over here. Anyhow, followed by the transfer letter. In transfer letter, normally there is a transport involved. Normally, right? So we have different scenario in our mind. It could be from low to high stream. It could be from side to mainstream. Side stream mean like the patient was in field. Now you are writing to the mainstream hospital. Patient was in periphery. You are writing to the mainstream. It could be from wards to emergency department. It could be from same specialty to like maybe surgeon to surgeon referral, GP to GP referral, and so on. Right? It could be one-way transfer, such as transfer to hospice care. There is no coming back. Transfer to nursing home, maybe from one nursing home for a period of time, and GP to new GP, right? So just to see the body paragraph, just to see how we can write it down, introduction, body 1, body 2, body 3. But remember that you have to be flexible with the format. Followed by the structure of the paragraph. followed by the structure of the paragraph. In structure of the paragraph, we have first is the topic sentence, which include the main idea or the presenting complaint, whatever the reason is, we should write it down in the topic sentence. Then we have supporting sentence. Supporting sentence may we can see that these are the description of symptoms and a significant treatment trend. We have to rewrite in your own words, change the form of the word from noun to verb and verb to noun and adjective and so on. Use some signal markers. These are some of the example of the signal markers to make it more coherent and more clear, right? Anyhow, that is followed by the some example how to translate it. Let's say if this was the case, patient mild abdominal pain, 2/2, pain consistent, word sitting bending. So you see that we have translated initially on 1st January 2019, comma, Mr. James reported, I just translate this thing, 2 week history of mild persistent with after like constant we are changing the word persistent abdominal pain, which aggravated replacement of words while sitting or bending. So you can see that with this line, we have translate into a complete sentence. And we try to change the or use the synonyms or the alternative words for the given statement. Let's say, again, another example, if not this the case, we can change in different way. 2 months back. Now, basically, let's say from today visit, if it's 2 months back, I'm just have given example. If from today visit, if it's 2 months back, 2 weeks back, whatever, Mr. Mark presented with a complaint of chronic mild abdominal pain. So now, constant, we can use chronic as well. It was a mild in nature, so we can just write it down. Chronic mild abdominal pain. However, it's intensified if he sits or bend, right? So I have another translation. We can see that the third example, Mr. Jones had. Because we are writing from today's perspective. That's why if this event was in the past, so I have written this thing in the past perfect tense. Had moderate abdominal pain, which was continuous in nature, constant, and worsened when he sits or bend. So you can see this with this example, it would be clear to you that how can you translate the case notes into your own language. There is another example that has been done for you. With this lecture, I believe it will help you, to learn and to translate the case notes into your own language. Anyhow, so case two, we have the past history. In this case, past history, we can see that just one liner. Notice blood in stool yesterday. So I can use the reported speech. He reported that he had noticed blood in stool or his stool yesterday. Case 3, let's say physio 4/12 still muscle stiffness. So we have Mr. Alex had attended physiotherapy for 4 months. His muscle stiffness did not improve. This had been done in the past perfect. This had been done in the past simple. So which can relate the timing of the event. Then we can also use this thing in the clause of contrast. Despite Mr. Alex had physiotherapy for 4 months, his muscle stiffness was not improved. So, as I just have tried my level best to mention all these things in details, so that you have an idea that how the grammar part can contribute majorly when you translate the case notes, right? Anyhow, so these are some of the example that has been done for you. Now, a major way to structure your letter or to summarize. So let's say we have patient had successful right knee replacement surgery and he was transferred to the ward. So patient returned to ward following right total knee replacement. Vitally, he was stable, for example. Okay, circulation was fine. Like there was only the hemoglobin level was low. That's why you have done transfusion. Whatever that has been written, you can read it quickly. Then on the next day, again, something happened. You can see that 1, 2, 3, 4, 5, 6, 7, 8. 8 dates has been written. And overall, if you can see quickly, or maybe from the eagle eye approach, you can see that it means that he was improving in the management of the ward. So we can simply translate all this information in one liner. I will show you in a while, right? And then he was transferred to the rehab. Let's say this is the rehab structure. This is the rehab history and this is discharge now. So what you can see that information tool, like for ward stay, we can either use past simple or maybe past perfect, right? Other sentence can also be used. We can use simple, compound, complex, depend upon the importance. We can concise and club the information. We'll not write down all the information together, right? So let's say these are some of the example that has been done for you. I will show you another example for that. That in this case notes, this was the thing that highlighted in the green, and this one as well is what stay. And this is the rehab, both things. You can see that how this letter has summarized those two things, what stay and rehab, in just this small paragraph. Let's say Mr. Johnson's ward and rehab focus on the patient mobility. So a summary or the you can say the central idea of both of the things has been extracted. Her stay remained uneventful, apart from low HB, for which intravenous blood transfusion had been done. So you can see for the liner or the one liner was that ward and rehab improve the patient mobility. There was nothing eventful and only this transfusion. So we have written this thing. We have omitted, may say that lot of details, PP, blah, 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 medicine has already been omitted, right? Anyhow. So followed by the discharge plan. Now this is a discharge plan we have expanded. Now you can see that we have written even the medicine with dosage and frequency and everything, right? This is how you can summarize the information if it's needed to be summarized for your case notes. Anyhow, so now it's about the body of the letter. How can you summarize this body of the letter? Thus, we have given three examples. Let's say, if you can see over a period of 9 days, his stay in ward was uneventful, except blood transfusion due to low HB, right? We can use it. It was simple or complex and possible. Then he had an uneventful stay in ward except intravenous therapy due to low HB. Beside that, he had been managed with Claxine and warfarin. However, Claxine was stopped on the 6th day. Now you can see that it's the case when you want to expand it. Just to give you an example, when you have to explain it, when the Claxine is being written the discharge plan, or if there is some contraindication, you can use this model, right? We can use gentle pour exercises were done which were effective and so on. That is followed by ward and rehab remain uneventful. How we can summarize this thing down? Just mentioned in the three different format. Now we can see this is a discharge plan. Discharge plan has to be expanded no matter what, right? We have to see that how can we discharge this thing up in your own language. So these are few of the example of the. Then we write, you can write on the date, then we can write on the designation or the name, then designation if it's given. The optional hospital address or department address, Lake Sword and Marlborough Hospital. Then doctor's name regarding patient name, right? Afterward, it should be your reason of writing, whatever the reason of writing is. Thank you for seeing Mr. Elvin, whose signs, symptoms, and investigation are suggestive of this thing, along with worsening of asthma. So main complaint has been mentioned over here. Followed by, if it's an urgent refer letter, we do write it down, today's visit, or the most recent history. Let's say, if you can see, there were two things, AMI and APO. So we made two different paragraphs for that. This is active or acute symptoms, right? In the first line of the paragraph. And then these are the mild symptoms. So we club them together to make it more clear, more concise, more appealing. Followed by the worsening of asthma that covered the past history and active issue that currently the patient asthma has been worsened due to his non-compliance to his medicine that covered. That is the current medication, sorry, examination, right? We have not missed anything from the current examination. Then you can see there is a socio economic details that is written over here in case of urgent letter. And now we have a conclusion, which include a transfer request, which include the differential diagnosis and the management that has been done before you have transferred. And that is followed by your sign of statement. This is your format of writing a what we can say urgent referral letter, but still this should not be considered as standard. You still have to see that if we have to write it down that particular information, we must keep certain thing in our mind that you should be flexible to the pattern that ever we have discussed, right? Now, in case of normal referral letter, we would see that again the date format. We would write it down the date of the exam normally, but from the last few exam, they would mention that assume today's date to be with assumption. We can see that is we have to write down doctor name, his designation, and so on. We discuss. Now we can see that we have introduction. Thank you for seeing Mr. Colester. Affective foreman. It shows the lifestyle. Who, according to my tentative diagnosis or initial diagnosis, has diabetes mellitus type 2. Now, with reference to type 2, our weight is important. That's we started with this one. Married with 3 children, it's just introduction. You can omit or you can write. Remain busy with his job. It means that he does not have time to do certain thing. And a sedentary lifestyle. Have written. Let's say if he is living a sedentary lifestyle. This is also important for the diabetes patient to mention about the infections and the known allergies. So you can see this was the non-urgent referral type of letter. So we can write it down socioeconomic history if it is relevant. If there was a past history of like sore throat and so on, we may not have written that thing over here. So now we can see that the next paragraph covered the summary of maybe 2 to 3 visits that patient had visited you. 20 days back, he reported being drained, lethargic, sore eyes, and had some dizzy spell for 3 to 4 weeks. He always described him to be tired on his every presentation. You can see I'm using the tired word because of the present description. We can also change this thing, maybe fatigue and so on, because you have used the lethargic. Despite he had been advised to modify his lifestyle, he was unable to do so. Now we can see afterward, this is recent history. Mr. Collister, I've done it again with the similar complaints. Now, I'm not repeating the complaints again. Mentioned all the complaints over here. I just use these similar complaints with addition of new complaint. Then the investigation finding, and then conclusion paragraph include the your, you can say the diagnosis, right? So is it clear to you? Any question that you want to ask?
Sir. No.
Test. So speaking test, you can see there. Let's say first of all we have 15 to 20 minutes for speaking. That is followed by the warm-up session. In the warm-up session, they can ask you some general question about your name, profession, hobbies, and so on. And there is no grade for this part of warm-up session. The purpose of this warm-up session to make you comfortable with the interlocutor so that you might not get confused or you may release your exam-related anxiety or stress if you are having any. So that is the purpose of having the warm-up session to make you comfortable and relaxed with the interlocutor. Anyhow, followed by the role play cards. You will be having 2 profession-specific role play cards. You receive the card one by one, and there will be 22 to 3 minutes time for preparation of the card. In this time, you can discuss the name of the patient, whatever you will be using during the time of consultation. You can ask any question if you're having from the interlocutor. Okay, and you can take the notes separately on a given paper with pencil. Okay, followed by the counseling time. Per card, you will be having 5 to 6 minute time. So independently, there will be 2 different speaking session with each for 3 minutes preparation time and 6 minutes for counseling time. A general overview for your speaking scenario. ID check is the most important thing that they will do first and foremost before they can start your exam. That is followed by the warm-up, already discussed. Stages of the role play card, we discussed that we have to see the setting. Maybe it's your clinic, it's your maybe ward, it's your ICU, it's your, let's say, we can say CCU, it's emergency department, and so on. We can also have the background information that is already being the part of the card, like you already know being a doctor, what had happened with the file, or it's the file of the patient. And then we have task fulfillment, which includes inquiry, explanation, assurance, advice, and so on. Okay. So we have different scenario. We have new patient versus old patient. We have first encounter versus second encounter. You have to see that which type of card you will have in front of you. This is the marking criteria as we had in your writing. It's also had 2 set of criteria. The first and foremost is the clinical communication skills, and second one is the linguistic skills. So what we have in the clinical communication skills is your PR building skills or personal relationship building skills. Number one. Number second thing is the perspective of the patient. Number third is the information gathering and information providing. So let's start with the PR skills. PR skill mean how would you start a conversation? What would be the greeting? What would be your tone? Right? Uh, According to the situation, scenario, setting, or the condition of the patient in simple word, according to the situation, you have to use the appropriate tone, right selection of word to start the card, right? After you had started the card, in not in the criteria but in structure of speaking, after you have started the card, not in the criteria but the structure of speaking, we have the greeting followed by the icebreaker or the rapport building skills. You can have, if your card allows you, to have some chit chat with the patient. You can praise the patient for something like, say, nice shirt, what a wonderful weather today. You like to have a glass of coffee or whatever. You can use those ice breaking statement to make the patient more comfortable, but those should not be used in the emergency setting. Anyhow, afterward, you can start with the open-ended question. In the open-ended question, you always have to see that you can ask the patient, how can I help you? Is an example of open-ended question. I have gone through a file and I can understand from a file that you are having this issue, but can you tell me your own words? This is also an open-ended question. Anyhow, these are the open-ended question that is followed by the closed-ended question. Closed-ended question are those questions where the patient has to answer you in simple yes or no format or minimal answer for those questions. Now, open-ended question followed by closed-ended question. The closed-ended question is also, we can say these are the collection of question or the group question that is related to from that disease, right? So we have to use the grammatical structure while go for the closed-ended inquiry question. In this part of time, you have to encourage the patient to participate. Try not to interrupt the patient and show the active listening skills at the same time and encourage the patient to participate and summarize when it's needed. After that, we have patient perspective. Patient perspective mean if you can see that the idea of the patient or the concern of the patient. Patient perspective mean that if there is a queue, you have to pick the patient queue, and you need to design the consultation as per patient response. Afterward, we will go for the information providing skills. Before you can provide information, you need to ask the patient, what do you know exactly about the problem, right? And then you have to sequence information, pauses while giving the information. There must be natural pauses for that. You have to organize the information, use the cohesive devices, and encourage the patient to contribute if he's not actively participating in the scenario. Followed by the linguistic skills. In the linguistic skills, we have natural flow of speech, number one. You must have the natural flow of speech. There should not be pauses and hesitation. Just try to have the normal flow of speech. Appropriateness is open term, like it should be a right start. It should be a right start. Then we have the, you can say, intelligibility. It should have a clear pronunciation. We have intrusive accent. We have the, you can say, natural intonation. Non-intrusive accent mean it should be understandable. We need to know like how to dip the tone and where to rise the tone. And accordingly, you have to use the word stress appropriately, right? Then we have a variety of grammar that has to be used, and use the accurate and appropriate grammar in the speaking part. These are the stages of the role play card. Just to give you an example of one of the card, you can see that there's a patient who is 10-month-old. He's here with, let's say, gastroenteritis. Patient is quite anxious. This is a cue that you have to pick. However, the child has shown no evidence of dehydration. He's passing urine regularly and is playing happily on the floor of your office. So this is the background information that you already know. So still you have to start from the patient symptoms. So how can you start the card? Where you have a script. Hello, my name is Dr. Andrew. I'm a doctor in this clinic. If I'm not wrong, I'm talking to Mr. James, and you must be father of Michael, right? Okay. Michael is, and James, I can see that you seem to be a bit concerned. Is everything all right? Then he will tell you, yeah, actually, from the last 24 hours, my son has not has been throwing up whatever he's eating, like just for vomiting, he can use throwing up. He's been throwing up whatever he's eating, and he has passed, so you can say, some stool, and I'm quite concerned he's dehydrated. You have to show empathy. Oh, Mark, it must be quite worrisome for you that your son has loose motion and he's been throwing up, right? So this is your active listening skill that you have to rephrase, and this is an example of empathy using those words. So then we can move on toward the collection of question. In order to better understand your son condition, I'd like to ask more question. How many episode? How? What about? What? Is he passing? Is? Have you documented? Let's say. So these are some of the grammatical structure that you have to use, and you have to ask some question related to the symptom of the patient. If your card allows you, go for the examination. If it's not, then we can move on toward a diagnosis and so on. When the patient was concerned about the hydration, you have to show and pick the patient's view that he has been passing urine regularly, and you can see that he's playing happily on the floor. Then you have to explain the diagnosis in the layman language, not the gastroenteritis, but in the layman language, right? You must have a proper signposting statement. Let's say after explaining the diagnosis, you have to ask the patient, have I made myself clear? Is there anything else you want to ask? Okay. And if you don't have any questions, I'd like to move on toward the treatment part. Can I? Right? We can go on and describe like that. So this is an ideal structure of speaking that you have to see in your speaking part. And you have time, you can go for the summary skill, right? So at this point of time, if you like to ask any question,